name is Saad Usmani, and on behalf of the DREAMM-9 study investigators and team, it's a privilege to present an updated interim analysis on the phase 1 study of Belantamab Mafodotin in combination with standard of care therapies in transplant-ineligible newly diagnosed multiple myeloma. Just to set up the stage, we know that belantamab mafodotin is an anti-BCMA targeting antibody drug conjugate that delivers a cytotoxic payload of MMAF to the BCMA positive cells. Previously, it has shown single agent activity, and more recently in phase 3 trials in combination with bortezomib and dexamethasone and in combination with pomalidomide and dexamethasone compared to standard of care, the Bela combinations have demonstrated improved progression-free survival and manageable safety profiles. Now, we know that VRD is one of the standard of care treatments that has been utilized for newly diagnosed multiple myeloma patients without intent for stem cell transplant. And there still remains a need for deeper, longer responses in this patient population. And so the objective of the DREAMM-9 study was to evaluate multiple doses and schedules of belamaf with VRD in this transplant-ineligible patient population. So the way that the study team approached this is for patients who are not candidate for stem cell transplants due to frailty and significant comorbidities, and otherwise were newly diagnosed. They were enrolled on cohorts of belamaf dosing at 1.9 milligram per kilogram, 1.4 milligram per kilogram, or 1 milligram per kilogram. The cohorts either gave doses every 3 weeks to begin with in the induction before going to every 4 weeks in maintenance, or every 6 weeks as part of induction, followed by every 8 weeks as maintenance, or in some cohorts, dosing every 9 weeks during induction and Q12 weeks during the maintenance phase. Safety was the primary endpoint, efficacy, relative dose intensity, cumulative administration of belamaf were secondary endpoints, and MRD also was utilized as an exploratory endpoint. So just to summarize the patient characteristics, a total of 108 patients were enrolled across the various cohorts between December 18, 2019 through March 4, 2024. And overall, as you can see, this was an older population, median of 74 years of age, and the range was 51 to 88 years. 46% were women, 15% had high-risk cytogenetics, 11% had extramedullary disease. Looking at the safety profile, you can see that about a third of the patients had grade 3 or 4 adverse events that were related to belamaf. And then, for patients who discontinued, the most common reason for discontinuation was adverse events followed by physician decision and then progressive disease. Fewer grade 3 or 4 events were reported during maintenance phase compared to the induction phase of treatment. And the most common ones were actually cytopenia, so thrombocytopenia, neutropenia. And then because the study was enrolling during the COVID pandemic, COVID-19 pneumonia was seen in 14% of the patients. But this has been described in other studies as well. Maximum grade 1 keratopathy and visual acuity events were reported in 11% of the patients, grade 2 in 19%, grade 3 or 4 in 55%. If you look at the proportion of KV assessments done, about 15% of the patients from that perspective had grade 3 or 4. Looking at the responses, you can see that they range from 71 to 100%. I would like you to pay attention to the 1.9 and 1.4 milligram per kilogram cohort specifically. These cohorts actually had a high response rates. And if you look at the depth of response in terms of CR or better, the 1.9 milligram per kilogram Q6 to 8 week, dosing cohort, was quite impressive. Then looking at MRD negativity rates, you can see that MRD negativity was high in the 1.9 milligram per kilogram cohorts, but quite appreciative and impressive in the 1.4 milligram per kilogram cohort as well. And the median follow-up on these arm is variable because of when they were enrolling, so we have to kind of keep that in mind. But overall, quite efficacious regimen for this older myeloma patient population. So the summary from this study is that across all dosing schedules, belamaf with VRD delivered highly effective tumor responses, MRD negativity rates in this transplant ineligible patient population. In particular, MRD negativity was 75% in the 1.9 milligram per kilogram Q3 4-week dosing schedule and 67% in the 1.9 milligram per kilogram Q6 and Q8 week cohort. And comparable follow-up durations, when we looked at longer dosing intervals, they were associated with increased time to onset of clinically meaningful BCVA or best corrected visual acuity changes. And once patients actually held the doses, the recovery was there. These were changes that did not persist or were permanent for that matter. There is a randomized phase 3 study that's being planned with belamaf and RD compared to DRD in the older transplant ineligible patients called the DREAMM-10. And we will have to see what the future will be for this quadruplet as we get more quadruplet induction mature data with the anti-CD38s. I would like to thank the patients, the caregivers, the study team who helped in the conduct of this particular trial, and the study was supported by GSK. Thank you so much.